Hello, my name is Pavel Kubik and I have a pleasure to be a medical ambassador for the Nuvia brand. Welcome to us Nuvia Pills of Science. This short presentation will introduce you to use the Nuvia fillers in the area of the nasolabial fold. This area is often the first and most basic aesthetic facial treatment. Remember that the goal of developing Nuvia fillers is not simply to create a better product. Our goal is to provide a specialist like you with a completely different product, with the best properties suited to the injection site, both in the terms of anatomy and physiology, allowing you to obtain the natural result in the safest way. During the aging process of the face, a number of anatomical changes occur, which change the appearance. Our goal is to restore a young, healthy appearance, not to make our patient look like someone else. In the area of the nasolabial fold, special attention should be paid to the progressive laxity of the skin, eventually leading to the appearance of the wrinkles in this area and disappearance and reduction of subcutaneous fat. Finally, this leads to the formation of a deep fold with the skin growing into the muscle layer that is in the bottom. The area of the nasolabial fold is vascularized by branches departing from the facial artery. Fortunately, this large vessel is first, easy to palpate, and second, it moves slightly diagonally in relation to the planned injection site. However, I recommend special caution in the upper paranasal part of the nasolabial fold, because there we can approach the cause of the facial artery and its branches. Asepsis is extremely important during all the injection procedures, and in this area, we should pay special attention to the proximity of the nose and mouth, which may facilitate the introduction of pathogens to the injection site. So, first of all, proper disinfection, and secondly, keep the rules of asepsis during all the procedure. Nuvia fillers are currently the only injectable products based on hyaluronic acid that have been tested in vivo, which allow to demonstrate the beneficial effect of PEG cross-linking for both mechanical and biointegration properties, but also for the immunomodulatory effect, reducing the risk of inflammatory consequences of implementation. In my opinion, the best choice for nasolabial fold is Nuvia Intense LV. This product, thanks to its rheology, combines excellent the tissue filling properties with great freedom of operation in condition of strong deformation, which, due to mimic moves, must be taken into account in this area. It is recommended to administer into the shallow layer of the subcutaneous tissue using a 22G cannula or 27 to 30G needle. Depending on the patient needs and the preferences of the doctor performing the procedure, we should usually choose one of two techniques for this area. From one access point using the cannula or from several points using a needle. Anyway, the product is administered subcutaneously because then we cover the anatomical aspects of aging in this area in the best way. When using a cannula, which is my personal preference, I make the access point in the lower part of the nasolabial fold, and then, working at different depths under the skin, I gradually inject the product. You can see this in this short video. At first, we make the access point with a needle. Just be careful about the blood vessels that you can see, not to bruise the patient. We'll of course use Nubia Intensal V using 22 gauge cannula. I help myself with my non-dominant hand to pick up the skin during the introduction of cannula, and then I go straightly through the whole nasolabial fold to its upper part and slowly injecting with a retrograde technique. And then I go a little more superficial, as you can see, because of the wrinkle that appears in this area. I just check, palpate the material if it cannot be felt by the patient. If it can be, then I press it gently. Working with a needle, I carry out the administration by subcutaneous insertions of small linear deposits arranged perpendicularly to the nasolabial fold, spaced every 3 to 5 millimeters, which allows for the construction of support that behaves flexibly during the facial moves. We have also prepared this in the short video. This is the same patient as in the previous video, but the other side. We are using Nubia Intenso V with 27 gauge cannula. As you can see, I'm going retrograde every 3 to 5 millimeters under the skin, not in the skin, I'm under the skin. Using retrograde technique, creating the support to the skin. Just be careful about blood vessels, not to bruise the patient. You should not expect the facial artery in this location and this depth, but you can palpate it before the procedure. Use a very small amounts that you will not see material after the procedure. Remember that we are giving a support in the subcutaneous tissue and go down to the end of the nasolabial fold. If you can see the areas that need more support, just go back. And now, in the paranasal part, I go down deep to the bone, aspirate, and create a bolus. This bolus is usually around 0.2 ml. Remember to often disinfect your area. This is not clean area because of the nose and mouth. If you can feel or see the material, just gently press it. You don't have to massage it. Sometimes it's wise to massage the material if you used the higher amounts per one point. So do not use much material in every point. And at the end, just gently press the area. The selection of patients in this procedure includes, first of all, the exclusion of health contraindications, such as infection in the area of the planned procedure and skin diseases that prevent the administration of hyaluronic acid fillers. We have to take into account possible asymmetries in the injection planning. You should also do a physical examination of the area prior to the implementation of filler to ensure that there are no palpable pathological changes in the tissue and to ascertain the cause of the facial artery. In the example you can see, there is our patient from the video in whom I performed a cannula treatment on her left side and a needle treatment on the right side. This is a condition immediately after the procedure, so you can still see the post treatment irritation that disappears in about 30 to 60 minutes. The results on both sides are similar, although, in my opinion, discreetly supporting the use of the cannula, both in terms of aesthetic effect and the occurrence of post treatment irritations. Thank you for your attention. I hope you enjoyed it and see you soon.